Military service exposes people to repeated trauma, loss, danger, and stress over long periods of time. When service ends, exposure doesn't simply disappear. For many veterans, the hardest part begins when they return home. Post-traumatic stress disorder develops after exposure to severe or life-threatening events. Veterans with PTSD may experience intrusive memories, nightmares, and flashbacks so vivid they feel threatened again. Everyday sounds or movements can trigger intense reactions. Clinically, PTSD symptoms fall into 4 groups: intrusive memories, avoidance of reminders, changes in mood, and heightened reactivity. Veterans may struggle with sleep, anger outbursts, or emotional withdrawal. PTSD significantly increases the risk of substance use. Alcohol or drugs can temporarily quiet intrusive thoughts and anxiety. Trauma also alters brain chemistry, lowering natural endorphins and increasing depression. What begins as self-medication can quickly become addiction. The connection between PTSD and substance use in veterans is well documented. Over 20% of veterans diagnosed with PTSD also meet criteria for substance use disorder. Nearly 1/3 of veterans entering addiction treatment have PTSD. Heavy drinking rates are significantly higher among young veterans than civilians. Alcohol is the most common substance involved, accounting for over 65% of addictions among veterans entering treatment. Chronic pain from service-related injuries increases the risk of opioid dependence. Marijuana use is also prevalent among veterans coping with stress and trauma. PTSD, addiction, and instability often reinforce one another. Veterans are disproportionately represented among the homeless population, with mental health conditions and substance use playing a major role. Without treatment, reintegration into civilian life becomes really difficult. Veterans are not limited to VA facilities for care. Many addiction and PTSD treatment programs are covered by TRICARE. Avenues Recovery provides evidence-based treatment for both trauma and substance use. Reach out for recovery today.